ovulation is the release of that egg. That egg is released as a mature egg into your fallopian tube and hope to be fertilized in order to turn into a pregnancy. So today we're going to talk about our periods. So what exactly is your period? Why does it come and what changes come along with it? We think of it as occurring or that it can be divided into 4 stages. The first stage is actually your menstrual flow, and so that's what we think of like when we call our period has arrived. We're thinking of bleeding, bloating. That's typically day 1 through 5 for most patients. So around day 4, you maybe start spotting, and it's towards the end of your period. Those who have longer cycles may notice that their period lasts for 7 days, and that's actually okay. And then begins what we call the follicular phase. That's when you start selecting out the follicle that you're going to ovulate that month. So you're starting to grow one of the eggs essentially. There's different hormonal changes that come along with that as your estrogen begins to rise. The next phase is what we call your ovulation phase. And so that's when that big follicle that was selected out actually ovulates. And ovulation is the release of that egg. That egg is released as a mature egg into your fallopian tube and hope to be fertilized in order to turn into a pregnancy. And with that, LH, which is a hormone from your brain, starts to rise as well, and that heralds in ovulation. Last phase is what we call your luteal phase, and that's hallmarked by an elevated progesterone, which confirms ovulation. In your luteal phase, your hormones start to go down as you head into your next cycle, especially if you're not pregnant. And that's how we essentially have another menstrual cycle or another sign of bleeding, is your progesterone will actually start to drop. You may notice some physical changes and mood changes with that drop in progesterone. And then what actually comes in is another period, and you're starting those cycles all over again.